Dentistry can be a little bit painful. You need an anaesthetist, and it's interesting that the Prime Minister has had some medical experience as an anaesthetist in the House of Representatives.
And you will see what the government's precise policy is in just a week or so. Tony, that was 2.5 years ago. We are still waiting for a policy on hospitals. Health Minister for 4 or 5 years. You have been Health Minister, frankly, for twice as long as we have been in government.
Have you noticed any difference? That's
Tony,
the question you've got to ask.
I was at the Royal Brisbane Hospital the other day, where we opened and saw operating now a new operating theatre funded by us. I've done this right across the country, a new cancer centre in Darwin, which you said should be called the Tony Abbott Cancer Centre.
Because we funded it.
Can I just...
Yeah, we funded it. And you know, as the Director General in Queensland, you closed 6 operating theatres, so it's good to see you finally got to open one.
What Mr Abbott did as Health Minister was take $1 billion out of the system. Well, if it's wrong, why did Mr Abbott and the Liberal Party pull this material down from their website this morning? Can I say it's a pretty basic question of transparency and accountability. This, I believe, needs to be answered because it goes to what they would do in the future given they pulled $1 billion out on the previous healthcare agreement.
Let's answer this question.
Look, Mr Rudd asks for me to cooperate with him, and then he tells blatant lies about my record. It's just not good enough, Prime Minister, but it's so typical of you. You think that cooperation means agreement. You think that in order to cooperate with you, people have basically got to just accept everything you say, and that's no way to run a country.
0607, minus 372 million. And of course we know from the Department of Health that it went on to minus 400 million plus. Then what we had was the extraordinary attempt a day or so ago or at the end of last week, with Mr Abbott seeking to defend his record, claiming $500 million which we, the new government in 2008, added to the system to deal with that which he'd taken out, and then in his produced graph claimed it as his own. Well, that is, I think, a little too slick for words, but I'll just leave that to one side.
What I won't do, though, is just throw money at the states, which is what the Prime Minister did early in his term. He increased funding to the states. Fair enough, give them more money, but get a result out of them. He said when he gave them more money that there would be some 3,700 new beds quickly. The AMA reports that there is no evidence whatsoever of any additional public hospital beds as a result of the Prime Minister's increased funding.
500 of those beds, I'm advised, are already done. We've got another 1,500 to do. We are making some progress. The key thing is to make sure that you are making it possible, however, with extra doctors and extra nurses. You see, these are the lifeblood of our system. For doctors and nurses watching today, all of this is just words unless we have more of them to drive the system for the future.
But if we are going to have a rational healthcare system, there has to be the possibility, in many instances at least, of some out-of-pocket.
It would take into account all the local costs in rural areas and the rest to make sure it works. But if that doesn't, then of course we'd look at a form of national block funding which was able to underpin the continuation of smaller rural hospitals in the future. They have a vital part in the future delivery of health services to Australians.
Well, the Prime Minister has just now changed his policy because this wasn't the policy that he announced a couple of weeks ago.